Hi, this is Dr. Rosh. I'm here to just discuss a video we put up recently that went viral, and it was on filler migration and what I believe about it. So there are some popular questions that I'm just going to address, and I'll talk about the whole subject. I believe in migration. I believe in shit injections. They're going in the wrong place.
Really?
Or the wrong product, yeah. I don't believe in migration.
Your lips are migrated?
Yeah, so what's happened is they've done an injection technique from the white lip to the red lip. So their needle's been the white lip going into the red lip. Filler follows the path of least resistance going back up to the white lip. Of course it does.
Right.
Everyone calls it migration, but it's really wrong technique, wrong place filler, wrong type of filler. So this is a really good question, and it's probably why Russian lip technique initially looks maybe better than other techniques, but over time it doesn't. Now I have to explain it to you. So the Russian lip technique injects from the white lip. I know some people don't understand that, but it's the white border compared to the red lip, and it injects in there, and then it ejects along the border. And what they use a very fine needle injecting along the border to make it look amazing as you leave the clinic. Now that border we're talking about, it's called the million border, is 2 millimeters. It's astonishingly tiny. And sometimes with filler we think we can inject everything, and injecting that border really, I would say 100% of the time, causes it to burst. So when you leave the clinic, this border is crisp, but it's not a border that can contain the filler. So over time, a week or 2 weeks, that filler is going to spread some down into the red lip, which is totally fine, and some up into the white border, which then leads to this migrated look that I did talk about. So it is absolutely possible for it to look brilliant when you leave and look a bit worse in a few weeks' time. Actually, that is, I think, the normal of Russian lip, and that's why some people think that it looks better, and probably initially it does, but over 2 weeks to then 6 months, year, if not longer afterwards, it looks more puffy, more duck-like. Migration is filler relocation, and that is the definition of it. My point is that I wasn't saying I never believe in filler not relocating or migrating. Of course it can. What I'm trying to say is that often bad technique or bad product can lead to filler going to what is normal and a normal place that then looks bad, and people call it migrated filler, almost as in blaming the filler rather than themselves. Collagen and that kind of structure will help keep things in place, but ultimately if you use the right product and you inject in the right area, filler will not relocate or migrate. And so most importantly is the type of product and the injector's technique and their experience. Yeah, so I agree there's a lot of things on migrated filler, and I've spoken about it a lot on the past. A lot of the research you talk about I may or may not agree with. Just because something's published doesn't mean I agree with it. Aesthetics is still really early in its research, and a lot of things that are published I do not agree with. I actually wholeheartedly disagree with. But you have to understand, when someone's publishing, it's their agenda to get published for their name to be recognised. Doesn't necessarily mean it's correct and right what's happening. And we're seeing that a lot now, even with things like the Lancet issuing apologies for research being done. My point here is migrated filler and relocation of filler can happen. That tends to happen when filler gets caught up in muscle and it moves. Let me give an example. Let's say someone injects a bit of filler into the lip, and they inject it into the muscle. That filler then forms a lump because it's squeezed through the muscle fibers, and it forms a lump because it's squeezing through the muscle fibers and it was placed in the muscle. That is a relocation and migration of filler to lead to a lump. Filler that's injected from the white lip or the white border into the red lip, and the filler then going back up that path, back up to the white lip, is not migrated filler. That's part of the plane you've injected it in. That's a connection point. Filler follows the path of least resistance, is going to go up there. That should be an expected result. That's what I've been trying to explain. When you get a ledge secondary to that technique, that is an expected result. That is not migrated filler. So that's the definition that I'm just trying to, that's what I'm trying to differentiate, is that when you get that ledge secondary to that technique, you should expect that. And that's not migration of filler. Migration of filler is relocation to a place you're not expecting. Yeah, obviously migration is a thing. I wasn't trying to totally rubbish migration. I've seen migration across the whole face. So I've dealt with probably some of the highest number of migrations in the world because I do so many corrections. I think we did a calculation, and the fact that I can do, more than 4 or 5 corrections a day put me as one of the top people correcting in the world. Of course, I see migrated filler, I see everything. The point that I was trying to get across here was that yes, poor technique leads to moving a filler. Whether that's migration or not, or an expected move, is the difference. And so I want to classify migration as something that is a relocation to an area unexpected. So fillers placed, it relocates to area, it wasn't expected, that is migration. The correct technique was used, the correct product was used, and migration happens. That's actually quite rare, but it can happen. Filler being poor, filler technique being poor, the poor product being used, and filler moving to an expected place that leads to a bad aesthetic outcome is not migration. That's a bad aesthetic outcome due to poor technique, poor filler. I think that's a really good question. And so you have to take a step back and you have to go to someone you trust. Okay, so when you're doing your lips are a very aesthetically beautiful part of your face. Everyone looks at your lips when you talk. And so you need to go to someone you trust when you do that. For me, aesthetics is not a value kind of industry where you're looking for the cheapest. You should be looking for someone who's got experience, done it before, and can deal with any complications that may arise. Um, the right practitioner will definitely use the right products. The products I will use, so the products I'm using at the moment is something called Wrestle and Kiss. It's a fantastic product for lips. It integrates wonderfully. It's moldable. It's safe. After you inject it, it doesn't feel stiff or hard, and your lips still feel natural. And so that's just one example of one product I use. If you compare the price of that compared to some of the other products we use, that's astonishingly more expensive, but I use it because it's one of the best products on the market and I love it as a product. And so I'm not saying there are not other products you can use. There are lots of other good products, but you want to be going with one of probably the best products you can. And often it's the best filler doctors that are using those best products. Yeah, I've always got concerned when I've heard that someone's used cheek filler in someone's lips and they're trying to save on cost. The filler you use for your cheeks, your chin, your jaw is not made for your lips and is not appropriate to be injected. The filler used for your under eye is not appropriate to be injected into your lips. They're different products. So you need to get a product that is bespokely made for lips that is going to give you the result you want. Sometimes I feel lips that feel so hard and so rough, and I know the product being used probably been a chin or cheek product and it's stiff. It doesn't give a natural feel and it doesn't give a natural look. The the thing we talk about when we talk about fillers, so fillers are gel, is we talk about rheology, and it means is the science behind the filler. So it's a gel. How does it mold? How does it act under compression? How does it place? And how easily does it move? All these are considered when they're making a product. So when I use Wrestle and Kiss, the whole point is called Kiss. It's made for lips, and it's made to stay in there. It's made to help an injector get a better result. Yeah. So when you look at these kind of package type deals that are on the market, so I hear them like Kim K or whatever it may be, 5 mils for 150 or £200, and they're trying to mix everything all together in the face. It's just impossible. You're using different fillers for every area of the face, different filler for nose, different filler for cheek, different filler for chin, different filler for lips, different filler for under eyes, different filler for even fine lines. So it's impossible to be having a filler that can be used for all of that. And so when you're looking at these packages, my biggest concern is these packages you think are going to make you look better, but they in fact make you look worse. So, you have to be really mindful when you're going for these kind of package deals, what you're really expecting, and then, you probably are going to get something you don't expect. I've dealt with a lot of package deals, what I mean by that is I dissolve them, I don't offer any package deals. And so when you're going and you're inquiring about aesthetics, the most important thing is make sure that you're going to hopefully feel better and look better after you're injected. If you're not, it doesn't matter whether it's cost you 60, 70% less. There's no value you can put on looking in the mirror and not being happy with the result. Trust me, it's not worth it. Yeah, I would say if you watch my YouTube, you're going to see I comment on migration, and there are some really amazing, astonishing migrated patients. One of them involving an area near the temple, and I don't want to ruin it, but it was just a really crazy experience where someone had lived with a year with something that had been happened, and Phil had been migrated, and I corrected in a day, despite us seeing hospitals and everyone. And so um, you'll see me continue talking on that and showing migration fillers in the future.